First, when he chose this for me, I accepted immediately because it's very interesting. Renal denervation or RDN, non-resistant hypertension brew. Why? This is my disclosure. We know that blood pressure control remains poor despite antihypertensive drug therapy. 37% uncontrolled and untreated, و37% uncontrolled and untreated, only 28% controlled and treated. وده بنشوفه في only 50% still taking their medication after 1 year. ودي مشكله في الادهرنس وفي الكومبلاينس. لما بنيجي نبص على الاستراتيجيز عندنا في البلاد بريشر، هي ما فيش عندنا غير اللايف ستايل اللي هي محدش بيعملها، والكومباينيشن دراج ثيرابي. الكومباينيشن دراج ثيرابي هنا 75% ل 80% of patients respond to 2 drugs, 90% to 95% more than 3 drugs. Overall resistance to drug therapy is poor. Half patients stop their blood pressure medication within 1 year. Most patients with hypertension require multi-drug therapy. Adherence decreases with an increasing number of blood pressure medications. Therefore, we have to change the strategy, and the new guidelines and the new consensus adding renal denervation as new blood pressure lowering strategies are needed. So we have lifestyle changes, combination therapy, and RDN. والسؤال هنا, what are the indications of RDN? Who are the best patients to refer? The FDA approved 2 devices, radio frequency and ultrasound, indicated to reduce blood pressure as an adjunctive treatment in patients with hypertension in whom lifestyle modification and antihypertensive medications do not adequately control blood pressure. Does it work? Yes. The second generation RDN sham controlled trial show that there is consistently reduced blood pressure across a variety of patients with mild to moderate hypertension, as well as more than severe hypertension, both in presence and the absence of concomitant antihypertensive pharmacotherapy في الambulatory وفي الoffice blood pressure. في global simplicity registry follow-up data at 3 years and sustained blood pressure reductions over 3 years with RDN global simplicity registry برضه ورد ان في 16% reduction في الميس وفي 10% increase في التارجت of the blood pressure. The RDN decreased the blood pressure without increasing the medications at 3 years. برضه في global simplicity registry. There is sustained blood pressure reductions and lower medication burden after renal denervation out of 9 years. Long-term reduction in the 24-hour ambulatory blood pressure after 9 years. There is also relative risk reduction measure, cardiovascular reduction by 20%, stroke by 27%, heart failure by 28%, ischemic heart disease by 17%, and cardiovascular deaths by 13%. Are the effects of renal denervation durable? The answer is yes. There is sustained blood pressure reduction with RDN registry data. We have it 9-year, clinical trials by 3 years. So when the patient asks, will my blood pressure stay controlled? And the answer will be data out of 9 to 10 years shows good blood pressure reduction with a single procedure. What evidence do we have that patients will actually want this procedure? We have first the guidelines. In 2023, European Society of Hypertension, Arterial Hypertension Guidelines stated that with uncontrolled blood pressure despite the use of antihypertensive drug combination therapy, or if the drug treatment incites serious side effects and poorly quality of life in patients who having eGFR more than 40. And in the SKY position, the patient with uncontrolled hypertension despite attempting lifestyle modification and antihypertensive medication, but who are either intolerant or medication or do not with to be an additional medications. Many patients around the world would choose RDN for hypertension. This is a surveys conducted in Germany, in Japan, and the United States reveals that patients are willing to try RDN for different reasons. 38% of German patients with hypertension on no medication, and 32% of Japanese patients, up to 31% of patients comparing blood pressure reductions and risk from off and on medication studies. 42% of participants would prefer RDN and additional antihypertensive therapy. The patient preference for therapies in hypertension, this is a cross-sectional survey in German patients, stated that those patients would prefer to take the RDN as a therapy. Is renal denervation safe? Yes. The procedure-related complications from the radiance and hypertension solo and the trio radiance is well tolerated. Renal artery stenosis in a meta-analysis of 5,769 patients with 10,249 patients years follow-up. There is no renal stenosis or dissection. Pooled annual incidence rate of stent implantation most occurred within the first year post-RDN. The renal function, no significant change in the eGFR after a mean follow-up of 9 months post-RDN. And the second generation RDN, as we see here, is controlled. No major procedure or device-related adverse event. No evidence of procedure-related safety issues beyond risk associated with femoral artery access. Extremely low progression of renal artery stenosis and no significant decrease in renal function. Given durable clinical effects, a substantial regeneration does not seem to occur. There is no post-denervation regeneration. And here, the cost effectiveness in the United Kingdom show that the model-based analysis suggests that RDN reduces the clinical events and is cost-effective intervention in the United Kingdom healthcare system. And we can see here that we can use the RDN in uncontrolled hypertension plus 2 drugs, or medication uncontrolled with the 3 drugs, medicated controlled hypertension away from the resistant hypertension, and in responder sympathetic hypertension and non-responder structural hypertension. So renal denervation can be used in patients with mild and moderate and uncontrolled hypertension. So the FDA has approved the RDN devices for management of hypertension, having demonstrated efficacy and safety for the treatment of uncontrolled hypertension. Latest international guidelines define criteria for patient selection for RDN and emphasize the importance of shared decision-making and patient preference. RDN is the third pillar of therapy, and thank you very much for your attention.